Rapunzel syndrome, also known as Trichobezoar, is a rare medical condition characterized by the presence of a large hairball in the gastrointestinal tract. The name Rapunzel syndrome comes from the fairy tale character Rapunzel, who had long hair that she let down from a tower. This condition primarily affects young females, typically those with underlying psychiatric disorders such as trichotillomania, compulsive hair pulling, and trichophagia, compulsive hair eating. These individuals may have a habit of pulling out their hair and subsequently ingesting it, leading to the formation of a hairball in the stomach or extending into the small intestine. The hairball can cause a variety of symptoms, including abdominal pain, nausea, vomiting, loss of appetite, weight loss, and constipation. In severe cases, it can lead to a blockage in the digestive system, which may require surgical intervention. Diagnosing Rapunzel syndrome typically involves a physical examination, medical history review, and imaging tests such as an abdominal X-ray, ultrasound, or computed tomography (CT scan). The definitive diagnosis is made by the presence of a trichobezoar in the gastrointestinal tract. Treatment for Rapunzel syndrome usually involves a combination of medical and surgical interventions. Initially, the patient may receive medications to address the underlying psychiatric conditions and to help manage any associated symptoms. However, surgical removal of the hairball is often necessary, especially if it causes obstruction or other complications. In some cases, laparoscopic or open surgery may be performed to remove the bezoar and repair any damage to the digestive tract. Following treatment, psychological counseling and support may be recommended to address the underlying causes and prevent recurrence of the condition. Additionally, strategies to manage hair-pulling behaviors, such as behavioral therapy or cognitive behavioral therapy, can be beneficial. It's worth noting that Rapunzel syndrome is extremely rare, but it is a serious condition that requires prompt medical attention. If you suspect you or someone you know may have this condition, it's important to consult a healthcare professional for an accurate diagnosis and appropriate treatment.